Hello, you're watching our special broadcast, Your Health Matters. This is a podcast where we have conversations about different kinds of problems that we all face on a day to day basis and the solutions to it, as well as India's global role in medical tourism. We'll get you all of this today. I'm Shreya Upadhyay, and today on this podcast, we're going to be talking about joint health and how India has been leading in global orthopedic revolution. Joining me in this conversation is Dr. Narayan Hulse. He is a principal director at Orthopedics at the Fortis Hospital in Bangalore. Dr. Hulse, welcome to WION.
Hi.
I want to start by asking you the magnitude of this problem, arthritis, joint issues. There are about 350 million people globally that are affected by it. In fact, US is a country where a leading cause of disability is arthritis. So it's not just the developing countries, it's also the aging advanced economies which are facing this problem. Help us understand the magnitude of this problem.
Arthritis or joint pain is probably one of the commonest ailment which human beings suffer all over the world. There are different varieties in it. Commonest variety, what you call, is osteoarthritis or a wear and tear. You might have heard the one which comes in the elderly age group. The people walk with limb pain. That's called osteoarthritis or a wear and tear of the bone. Essentially, the cartilage or a soft cushion inside the joint gets worn out. However, there's a commonest type, and it is about 70% people up to the age of 80 or 70 in that age group. But not all of them will have so much of pain needing some treatment. However, about 10% of the patients who have this kind of arthritis will require some treatment in the future. There are other varieties which are adding to the problem as well. For example, we have rheumatoid arthritis, ankylosing spondylitis. In nutshell, we have variety of diseases which cause damage to the cartilage. From any kind of damage to the cartilage, we have arthritis, and that gives rise to the pain, and the burden of this problem is increasing all over the world, probably because we are living longer. As we live longer, we have more time for the joints to get worn out, and also the obesity is getting more and more all over the world. And also other reasons for the joint damage. For example, we have sports injuries, trauma, accidents, and the lifestyle related diseases which are causing more problem, probably increasing the load of joint problem across the globe, along with increased awareness among the people as well. I think people are seeking more of treatment for this kind of problem all over the world, and that's why I think we are seeing them more and more in our practice.
So, Dr. Hulse, I'm going to come to the treatment part a bit later. I want to understand from you, you mentioned age, and this is according to the World Health Organization, around 300,000 children also globally face this problem. How much of this is age related plus gender? Does it affect women more than men? Because, of course, factually, we've seen that women have more deficiencies in terms of calcium than men. So, help us understand that dynamic.
So basically, there are two issues with this. One is a age-related joint damage, which is essentially seen in the older age group, not in younger people. However, we have something called as a secondary arthritis. A damage to the joint, it can come even in younger people. As I was mentioning earlier, any kind of damage to the knee or a cartilage can cause this kind of disaster. For example, somebody have a road traffic accident, damage the cartilage, that means they will end up with a damaged knee and a damaged arthritis for the future. Younger generation, for example, if the weight gain, the obesity has become a major problem in the world, and that also will put a lot of load on these knees, and they have more and more of this knee problem in the childhood, or at least in a younger age group. And other issue about the gender, it's more like a hereditary type. It's more like the woman bone, woman hormones, the calcium, and their lifestyle probably combine this arthritic process. Both rheumatoid arthritis as well as the wear and tear arthritis is more common in women. I think it's more like a hormonal and also probably a genetic predisposition having this problem.
Talking about problems, let's begin by understanding knee replacement. This is a very common problem. And when I was coming here, I was talking to a lot of people in my family, among my friends, and their parents. And they said that, look, we know that there is a knee problem when the knee pain starts, but what are the first few signs that one should look out for to understand that, look, now the wear and tear of your knee is creating an issue, it's deteriorating?
Yeah, and a very important point to understand is even though the arthritis or osteoarthritis, the wear and tear is so prevalent, not everybody needs a joint replacement surgery. Probably around 80 to 90% of the people can manage that with a simple remedies, which is available with every orthopedic surgeon in the country. Something like exercises, the weight reduction, the lifestyle adjustment, some simple medications can help them. However, they should also know a worn out cartilage is not regenerated yet. That's why we don't have a medical pill which can make that cartilage back. So either you adjust your lifestyle in such a way that you manage them, which can be done in around 70-80% of people, or a small number of people who needs a joint replacement surgery. That is needed when the pain becomes unbearable. For example, we call this as it interferes in their activities of daily life. For example, you have taken some painkiller, you have done lifestyle adjustment, but you cannot lead a normal life. You cannot climb stairs. Your pain is causing problem throughout the day. You have taken painkiller, it is not working. And some people also have pain during the night, they can't sleep. So in general,
But isn't the threshold of bearing pain different in different people?
yes, there is no matrix which can really measure pain. So ultimately we leave it to the patient to say that my life is disturbed with pain. It is not objective assessment, it's more like subjective assessment. But in general, a patient comes with a severe pain in their joint, an X-ray shows damage inside the cartilage, and their life is disturbed. That is when, especially in the elder age group, older people, we advise them to have a joint replacement surgery. In fact, this is one of the most successful human intervention probably in the history.
So you're saying that once it starts impacting your daily life, it is acting as a disruptor. The knee pain is when you know that this perhaps needs a surgery. Okay, so if that's the case, then what would you suggest, are the little things that we can do, do's and don'ts? Because there's Instagram knowledge nowadays. There's a lot of reels being made. There's Chat GPT now. There's YouTube videos. There's a lot of information that is floating around as to how you can assess what to do and what not to do. For example, don't run on a concrete ground, run on a softer ground, such things. How do you then, differentiate what to do and what not to do?
So the bottom line is there are a lot of information overload. Most of them are unscientific and probably unauthentic all over the place. The best thing for a patient in this era, if you have this kind of problem, is consult a qualified orthopedic surgeon to get a proper advice rather than doing something which is advertised on an Instagram or anywhere else. Bottom line to understand is the cartilage which is worn out inside the joint by the arthritic process cannot be cured currently. For example, any kind of injections, the medicines, so-called stem cells, injections given inside the knee joint, and a lot of kind of therapies, the magnet, electrotherapy, so many have been advertised. The bottom line, we cannot cure those cartilage yet. In fact, if somebody can cure the cartilage wear and tear inside the joint by any mechanism, it's a noble prospect, unfortunately. So it's important that the people should understand that we don't have a cure for the arthritic conditions currently. In absence of a cure, the next, whichever is the best available scientifically, should reach each patient, which should be modification in the lifestyle, management of their pain, reducing their weight, and you see there are a lot of help available for their management of pain and function. For example, physiotherapy, occupational therapy, lifestyle adjustment, weight reduction clinic, and some medications to help their pain. And if they can be done safely, they don't have to go through a surgical procedure called a joint replacement surgery, or currently a robotic joint replacement surgery is available all over the world, which can help these patients who cannot manage their pain, which is something simply done with a simple modification of their lifestyle or pain medications.
I'm glad you say that this is subjective and not everybody needs to go by that, because a lot of people also say that, look, nowadays doctors just force us into a knee replacement surgery. But I'm glad you say that, Dr. Hulse, that, everybody needs to assess on their own how much pain they can bear and whether it's disrupting their daily life. But, talking about the do's and don'ts, and how you said lifestyle adjustments is something that people need to ponder upon. When you say that, what do you mean? Because you've got smart watches nowadays who tell you you've walked 10,000 steps, and this is your heart rate and this is your walking speed. How do you assess all of that? Is that even reliable?
It's a lot of help is available to maintain your lifestyle and also control the pain. For example, the patient have to go to a physiotherapy clinic, obviously with a prescription of a qualified doctor. They will help them in about 10 minutes or 15 minutes exercise per day, how to get your knee stronger. If somebody has the body weight is above the permissible level, they can have simple exercises or something like swimming, for example, which will not put any weight on their knee. There is no prescribed rule as such how much you should run or walk. In general, the people who have knee problem or a hip problem, we advise them to avoid repetitive strain activity. For example, if somebody advises you, hey, go and get this skipping exercise done, you will lose your weight quickly, or sit on floor and do padmasanas or a Surya Namaskar or something of that kind to get your knee pain, we advise them not to strain this joint. For example, most of the time it is a common sense which will help them not to get involved into these kind of activity which will provoke the pain, and they may need like months and months before they get back to their normal activity after that pain is gone. So I think the best thing these patients can do who are not in so much of pain, who are not yet ready for the joint replacement, can approach their own doctor for all this help. The joint replacement is never prescribed. It's usually earned by the patient for their pain. So it is not a prescription treatment, it is not an emergency treatment. In fact, you cannot say the joint replacement is a compulsory operation. It is to improve the quality of life, and it is usually demanded or earned by the patient because of the quality of life they are going through.
Yeah, very, very wise words by Dr. Hulse, that it's not prescribed. Knee replacement surgery is earned by the patient, which means you're deciding whether you want to go ahead with it or not. It's an elective surgery. And also that common sense will help you. Don't go by Instagram reels, don't go by YouTube videos or chat GPT. Just use your common sense as to how much pain you can bear and how much of your daily life is impacted. In the same breath, Dr. Hulse, I also want to talk about hip surgeries. That is also something that is commonly seen. When is it needed? What do we do when we know that this is something that is creating an issue in our body?
So the hip is a ball and socket joint. It is at our groin crease where the thigh meets our abdomen. This is a ball and socket joint because it has a round, nice, a revolving kind of joint ball which sits inside the socket. And this also, like any other joint in the body, has something called as a cartilage or a rubber, which makes the joint smooth and the movement becomes easier. However, in the arthritic process, either osteoarthritis or any kind of arthritis, that cartilage gets damaged and it becomes irreparable with time. And that gives patients a lot of pain and also difficulty in their mobility, because this is the main joint of the leg. When the joint becomes worn out so much that patient cannot do their basic activity, these patients get something called as a hip replacement surgery. This model shows a ball is already replaced. What it means is you have an artificial socket and the ball both have no sensation. That's why the patients don't get pain. In fact, the hip replacements are one of the most successful operations because the quality of life with the hip replacement is great. And also the hip replacement patients, they recover much quicker even than the knee replacement, which is more common. Nowadays, in fact, the hip replacements are done using robotic technology. Hip replacements are also done using minimal direct anterior approach, kind of minimally invasive, or something like patients go home within a day. So these are all the latest advances which are available with a hip replacement as well as with a knee replacement surgeries.
Okay, so we've talked about the problems, doctor. I now want to talk about the solutions. And robotic surgery is something that you mentioned. First, help us understand what's the difference between robotic surgery and the conventional surgeries that we have been seeing.
So the robotic surgery is a precision surgery. If you think about a joint replacement, it involves removing the part of the bone and replacing that with a metal or a ceramic material. Now this ceramic material or a metal material has to go in a particular angle, particular direction, particular size and particular rotation. And all this cannot be done with a human eye that well. So that is why the robotics have been invented to give precision to the surgery what we do. There are several robotic machines available all over the world which can do this job. For example, if you want to do a robotic hip replacement, a CT scan is done before the surgery. And the CT scan will make a three-dimensional model of your own hip, and it will tell the surgeon the size, the angles and the various parameters even before the surgery. In fact, on the computer screen, even before entering the operation theater, surgeon can do a virtual surgery on them, and to that extent you can get the perfect precision angle for your hip replacement surgery using the robotic technology. On the operation table, on the operation theater, these robotic machines also help us to execute the plan. You have done a perfect planning, but we have to execute without the human error, the human precision, human capability. So the robotic machine can do those repetitive precision activities very accurately compared to the manual or a conventional techniques.
So, are you saying then that robots are taking over your role, the surgeon's role?
This is a good question, and it's a very common misunderstanding as well. Surgeon is always in command, and the robo is a tool for precision. Robo actually means a slave in the Latin or a Greek. So what it means is that the surgeon controls the robotic machine all the time. Don't be worried that you will be sent into an operation theater and a robotic machine will come and take over.
It's like a Hollywood movie, robots are coming and performing.
Currently it is there only in the
surgery.
movie. It's not in the operation theater. So what actually happens is the surgeon has a control on that machine continuously. In fact, these robots are not capable of doing all the steps of the surgery. In fact, these are not called as robotic surgeries. They are called as robotic assisted surgeries. The robotic machine will help us for those repetitive tasks which involves precision in a three-dimensional direction, which the human eye probably cannot do that precisely. So it is a surgeon who is in command, whereas the robotic is for precision.
So, are robotic assisted surgeries 100% reliable? There's no scope of error at all?
Now, error can happen. Error can happen with all activities what we do, whether you do manually or whether you do surgically. However, there are so many proofs, there are so many technological advancements to stop these errors happening. So there are set protocols, there are workflows which will prevent these technical problems can happen. For example, in earlier days, 20 years ago, the robotic machines were not that well refined, and there used to be so much of interference by the surgeon or the operating team to correct it. Whereas those machines have improved so much now, the errors have become very, very minimal. I'm sure the future generation of these robotics are going to be better and better, and the precision and the errors are going to be really good in the future.
This is, of course, your role, the surgeon's role, and how robots and AI is assisting the surgeon. But as far as the patient is concerned, is there any prep to it? What goes on when you're taking a patient into the OT for a robot-assisted surgery?
So the robotic joint replacements for a patient is exactly like a conventional hip replacement or a knee replacement surgery, except these patients may require a CT scan done before the surgery, because a CT scan is needed for the robot to understand where exactly the knee joint or a hip joint is located in your body and the size, etc. Other than having a CT scan before the surgery, there is no much different to the patient before the surgery, whether they are having a robotic surgery or a conventional joint replacement surgery. Whereas during the surgery, the patient is under anesthesia, so he need not do anything extra because it's a robotic surgery instead of a conventional surgery. I think as a patient treatment flow is concerned, it is same or similar to a conventional joint replacement surgery.
And does it take lesser time, or is it the equal amount of time?
It actually depends on what you call as a learning curve of the operating team. Initial few days, it takes longer because the surgeon, the team, the anesthetist has to get used to the machine. Whereas after around 10 to 15 cases, it becomes as good as the conventional. It will not take longer time, and it has no specific disadvantages compared to a conventional joint replacement. It's a tool in the surgeon's hand, and the surgeon has to use it properly.
But also, I want to understand from you, where does India stand then? When we talk about robotic assisted surgeries, when we're talking about how not just people from India, but across the world come to India for their medical surgeries and other assisted technologies, where does India stand at the moment?
And I think we stand as good as any other developed countries in the world, minus that the healthcare is not uniformly distributed all over in our geography. For example, if you take the big cities and metros and the good hospitals, the care taken inside these hospitals are probably as good or sometimes even better than many countries in the world. For example, the Western society, they have problems with the manpower. Some of the countries have problem with their finances, economy nowadays, and also the training and the expertise the doctors get in this country is amazing, because the volume of patients they see in a day probably is as good as some of them see for a whole month. So we have a large volume of experience with more difficult problems, more number of patients. And that is why I think the lot of people all over the globe are trusting Indian healthcare and coming here as a healthcare tourist. And we can see that most of the patients are going back and bringing more patients to the every hospital. And I think we are as good as any other country as far as the technology is concerned, as far as the expertise is concerned, as far as these robotics are concerned. However, we have a long distance to go, in terms of spreading this kind of technology and the great inventions and great facilities to the geography, all over the country, because it's underserved in so many other small cities, I think.
Yeah, which is what I was coming to next. How do you make it more accessible? Because within India, you've got the urban-rural divide, you've got the income divide as well. How do you make it more accessible?
And I think this has to be done in a methodical way, and also by the policy of the government. There should be a good training and infrastructure. The doctors all over the country should have great training, plus there should be an infrastructure where these doctors can practice the modern medicine. Second one, most important probably, is the awareness. And I think these kind of programs can help. For example, there are people in the corners of the country who won't even know the world of a joint replacement, and they are suffering in silence. And there are not many people who can help them. And I think the most important thing is making these people aware of the facilities, the technology, and this advancement which is available to take their pain away and improve their mobility. And finally, it comes to the economy and the finances. The cost which is involved in the healthcare is real. And I think what is important is, as these technologies become more and more popular, the cost is going to come down. And also there should be a policy level change, both in terms of the insurance companies, they should help these patients, and there should also be more awareness about taking the insurance. And finally, the government structure, which is probably the widespread network of healthcare institutions all over the country. I'm hoping one day they all will be able to provide these kind of services to the population all over the country. So if you have a good training, good infrastructure, good awareness, as well as if the cost is taken care by the society, I think these kind of inventions, the higher level of treatment can reach most of the people across the country.
Absolutely. And, I hope that more and more people get aware. And with our conversation and with your, deep insights, I hope people who are watching us across the world can understand what it means to not just take care of your body, but understand the solutions that are available and use them to your benefit whenever the body is asking for it. I'll leave this conversation here. Dr. Hulse, thank you very much for speaking with us on WION and sharing your deep insight.
Thank you very much. Thank you.